So thank you, Mason, for that great introduction, and you did definitely do CARES justice in your description of our center. So just a quick brief overview. I'm a senior project coordinator here at CARES, and I've been working with Mason and his team to launch their data hub. And so I also work with a variety of organizations from across the nation in order to build custom data systems. And so that's really what we do here. And we do that in a variety of ways. And so one of our main products here that I'm showing on the screen is just our CARES engagement network. And so pretty sure this is how Mason found us. This is how many other groups find us. And through this site, we provide mapping services with over 33,000 data layers that we make available. They're publicly available secondary data layers that we aggregate and sometimes light analysis on, provide those through our mapping system. And then we also provide a public community health needs assessment report that has about 100 indicators available within it. And those indicators were selected from many years of work with different types of hospital systems. Kaiser Permanente was instrumental in helping us get our first CHNA up, and just learning over time what types of indicators are really bubbling to the top when people are thinking about community health and community benefit. And so just wanted to point out that those tools are free and publicly available. Those are the things that we like to provide to folks. And we do have a number of hubs that we work with, yours being one of them, the Inland Northwest Insights, and we have others that include, as Mason mentioned, 4-H. We have some other hospital systems, some data alliances like this one in Rochester. We have several community action agency state associations, including Idaho and Washington. They both just came on recently. And then some other groups, for example, out of Appalachia. We have other projects that live outside the CARES Engagement Network, like our work with U.S. News and World Report Healthiest Communities rankings and others. But just to give you a little bit of background on our center. So this is the site that we've been working to build over the past couple of months. You can see here that just from the homepage, you can easily access a similar mapping tool to what we provide on the CARES Engagement Network. Custom community assessment report. So the process that I worked with Mason and his team to identify which indicators would be most meaningful and most impactful for your community needs assessment process to be able to create your community assessment report. And then we have a nice map of the area that's served here. So just sort of going through the site a little bit, you can see that there is some about information, just some typical information about who the sponsors are, who's supporting this work, what types of organizations are involved. We also have some news and updates available, as well as I think later on I'll show you some of the stories that are being collected with the help of the data as well. We do have a community research area, so these are some of those stories that are being collected that are data-driven stories and posted on the site and being shared. Then we really get into some of the tools that CARES is providing for this site. So here, when we click Map My Community, you can see that we have what we call starter maps here. So one of the things that I do and work with every day are people who are not familiar with GIS or Geographic Information Systems. And so one of the ways that we've found that is very helpful for sort of onboarding folks to using a mapping system is creating some of these pre-made maps, or what we call starter maps. So we've worked to put together, for example, a map around children in poverty, labor market engagement, food deserts, medically underserved areas. And so you can click any of these maps and get directly to the map room and be able to interact with the data, move around, change locations, those kinds of things. And so it is sort of a nice entry point for folks who maybe aren't sure about starting from scratch. But I want to start here before we get too much into the map room in the build a report area, because I think this is probably what you guys are most interested in here. So we have this community assessment tool that we've created. As I mentioned, we went through an indicator selection process. So while we have around 33,000 data layers available within our mapping system, we limit the number of report indicators because, as you can imagine, getting a community needs assessment report with that many indicators would be pretty overwhelming, right? Not very meaningful either. So the other thing that we do in terms of our custom reporting area is we define what we call custom geographies. So here, our first step in the process of creating a community needs assessment, we have a county selection process. So we could select here the state of Idaho, and we could select one or more counties within the state of Idaho. We could also select a foundation region. So we've pre-aggregated the counties in which each of these foundations serve. And then we also have a Draw My Area tool, which allows you to select from, for example, let me type in Idaho here and just zoom in a little bit. You can see here that I could select from those same options, state, county, but I could also select a series of cities, zip codes, census tracts, school districts, state house districts, or national congressional districts. And so if we're thinking about groups that do types of advocacy work, these additional geographies can be really important and also really powerful in which to view the data in. I'm going to go ahead, though, and go back to Foundation Region and select the Lewis and Clark Valley Health Foundation. And the next step in the process then is to actually select the indicators that are going to be displayed within the report. So you can see here that we've built a custom taxonomy in which to categorize the indicators. So we start out with some really general demographic information, right? Things like total population, household composition, veterans population. And I can select an entire data category, which means that I get all of the indicators within that category, or I can select just individual indicators that I'm most interested in. So I'll select a few demographic characteristics here. I will also show you that we have some social and economic factors. So you can see here we have things like children eligible for free and reduced price lunch. That's one of the greatest indicators that we have that helps us really understand childhood poverty. So that's something that we always recommend that people include in a CNA. We have a couple of different education related, so educational attainment for both young children and as you age through the education system. Some things related to income and poverty at several different levels. We have social associations and a social capital index, which really talks about sort of those networks or the organizations that are serving folks in a community. And then young people not in school and not working. So I'll select a few of these here just for demonstration purposes. And let me get some poverty in here. Then we get into neighborhood and communities, again, looking at things related to housing, so housing cost burden, no motor vehicle, use of public transportation. And one of the things that I want to point out as I'm clicking through or hovering over these indicators, you can see as I hover over any of the indicators, this little I button pops up, right? And so one of the things that we realize here is that data literacy really varies from individual to individual, right? Not everybody works with data day to day in their daily jobs. And so really understanding data methodologies, collections, margin of error, those types of things can be really foreign for some folks. And so we try to make it a little bit easier to understand, is this the right indicator to select and what is it telling me? So I can click on any of these little I buttons or information buttons and it tells me the data attribute. So we're looking at cost burden households, 50% of average monthly income. It's giving me a small inset map, so I know this is the area that I've selected, and I can start to see what some of that data looks like on the map. And then I also get a link back to the original source here. So if I wanted to learn more about where it came from, its methodology, those kinds of things, I could do that very quickly and easily. Additionally, we have a lot of health-related data, as you can imagine. So I can go through, here we have a lot of access information, access to dentists, mental health care providers, primary care. We have information related to prevention and insurance, some other types of utilization data. As we get into health behaviors, we're looking at things related to food access, smoking, physical activity, alcohol consumption. We also included we have some opioid related data that we're growing as we recognize that that's an emerging issue. And then health outcomes, which is really our mortality related data or outcome related data. So we can see things related to premature death, suicide, again, getting at some of those mental health and opioid related deaths, mortality and cancer rates, infant mortality, those kinds of things. So here I've just selected sort of a subset of indicators to create our report with. Again, you can select all indicators. We've added this button recently upon request from many of our groups, and just to get a full report. But this does allow for some customization. So if you are working with a particular population, let's say folks under the age of 18, you're working with veterans populations or folks over the age of 65, you want to look at those indicators that just have race and ethnicity breakouts, you can really tailor this report that way. So most likely you're going to select this comprehensive report option. It's going to show data for each of the counties that are part of the service area that we've selected. It's going to show those breakouts by population groups, so that includes race, age, ethnicity, and gender, and then show maps as well. We also have a couple of additional options that include a quick facts report, which just is a series of data tables for the indicators that you've selected. We also have an export data function, so if you want to export any of the data to Excel, you'll get a nice Excel file with that information. And then we do have a source and methodology appendix. So if you do need to cite any of this information, that's also easily available for you to do. So I'm just going to go ahead and click on the comprehensive report. And what you're going to see here and what's going to happen is sort of behind the scenes, we're crunching some numbers, right? So you can see here this first indicator that we're looking at is total population. And our reminder is that our location is that foundation regional area. So in total population, we have a nice STEM sentence that tells us a little bit about the indicator in context of the geography that we've selected. And then we have this same information reported to us in a data table. So here we're looking at report location as this first line, which is important to note because it's an aggregate then of all of the counties that we've selected within that healthcare foundation region. So this is an aggregate, and then we see the values for each of the counties within the Lewis-Clark Foundation region. We then see information for each of the states as well. So this is really important for benchmarking purposes. How well are we doing compared to, right? Asking that question, the state and the national average. And since we have counties that cross, it looks like 3 states, we get the values for each of the states where those counties fall. Under that data table, we do have a link, again, back to the original source, and you can click that show more details link, and it'll give you, again, some information, some data background, some methodology, and any additional notes or data limitations that we find significant. In addition to the data table, we also produce a map that shows you quickly just an overview of the indicator that we're looking at. So here we're looking at population, total population. As we scroll down, you can see that now we're getting into some of those what we call population groups. So we can see the same information broken down by gender, male and female. We have a nice visualization that shows us that as well. We have total population broken down by all of the available age groups. And again, a nice interactive visualizations to show us that as well. We get into some of the reported races. So we can see it goes through white, through African American, Asian, some other race or more than one race. And again, a nice visualization for that. And so really this is the template or the cadence that we have for each of our indicators where we have those population groups breakouts available. Down here at the bottom, you can see there's this nice little circle hamburger menu, and I can click that at any time and be able to jump between indicators. So that total population indicator is a pretty big one, right? Because there's a lot of demographic information in there. But for example, if I wanted to jump down to something like children eligible for free and reduced price lunch, you can see I'm able to do that pretty quickly through the navigation. So again, we have a nice stem sentence here that tells us a little bit about the indicator, right, in context of the geography that we've selected. It looks like about 41% of students in this area are eligible for free and reduced price lunch. We can see that again in this data table, and you can see that it has a nice green number here, meaning that it is lower than the state or national average. Again, this is important to note that this is an aggregate for all of those counties that are included within the report location, and then we can actually see the values for each of those counties. And I point this out because many times as I'm working with groups, it's really important to be able to say, we probably shouldn't be spending a lot of time, for example, and I'm going to butcher this, probably Lata County or Lata County, for example, we should probably be spending a little bit more time maybe in Clearwater, because the rate there is much higher. So having those individual county breakouts can be very helpful in really helping people target what types of interventions and initiatives that they want to put in place in any specific geography, right? Again, we get to see those numbers for the state and the nation for benchmarking purposes. And then that's also given to us here on the right-hand side in this nice dial. So what we're seeing here is that report location aggregate is less than, right? The state of Washington here is what we're benchmarking it to, and the state of, the United States. And so that's what you're seeing here in the dial. This is interactive, so if you ever wanted to just compare, the report location to a state or to the rest of the United States, you can click those things on and off. Again, underneath there, we do have a link back to the original source and some additional details. One thing to note is anytime we can provide the data within the map at a smaller geography, we will do that. So it's important to note that because these numbers are showing for county level information. But this map is actually showing at the school, the point level. And so you can see that these are individual schools here, and we can sort of start to see the variation in terms of free and reduced price lunch at the school level. And you can click this to go into our map room, which I'll demonstrate here. So another thing that we get asked about a lot and that we try to provide when able is change or trends over time, right? So anytime we have an indicator that is available consistently across years, we will provide that information over time. So this is a good example of one of those indicators where it looks like we have information dating back to 2010. And so we are able to see sort of how those trends change over time. And this isn't a good example of where you maybe want to turn off some of those other counties and be able just to see a few maybe in comparison to the state and national averages, right? So really what's going on here in Oregon? Why did these numbers change so significantly? Helps you start to ask some of those questions, right? So not all indicators are available over time consistently. Sometimes methodology changes, so we're not able to validly show comparisons over time. Sometimes release dates or release cycles change, and so there's a variety of reasons that sometimes we can't do it, but we do definitely try when we can. This is a good example of an indicator that's showing a red dial. So it looks like the report location in terms of associate's degree or higher is slightly less than some of the state, well, it looks like from a couple of the states' averages. And so you're seeing that shown here as a negative or a red dial. So again, as you're going through and identifying maybe priorities for your community needs and the subsequent actions that you're going to take, sometimes looking for those red dials. Where aren't we doing quite as well in comparison to or when we benchmark to the state and national averages can be sort of a quick way to start some of those conversations. So basically, all of the indicators are broken out the same way. As we get down into things like opioid drug claims, you're going to see the same sort of data table. You're going to see that same inset map. Where available, again, you're going to be able to see those trends over time. So basically, if you can read through one indicator, you can read through them all. And so we really look to do that in terms of our user experience here. So those are some examples of the report outputs. I'm going to scroll really fast back to the top here, give you a couple of other updates on the report, and then I'll stop and see if there are any questions. First off is you can download this very easily to a PDF and have it as a report. You can share it on social media. I always joke that this probably isn't the most exciting thing to share on social media, but nonetheless, it's available. More importantly, though, if you click the share button, you can email it. So if you wanted to share a report that you were working on or refining with a colleague, you can do that pretty easily. You can print it, or you can, again, export it to Excel. And so you're able to get some of those raw data if you wanted to, for example, pull it into another analysis system or marry it with some other data that you have. So that's really a brief overview of the reporting environment. I'll pause and see if we have any questions sort of about how that functions or flows.
I have one. This is John. Is there a way to get at, say, the largest variance from national or state norm, whether it's in the clinical and the clinical outcomes stage or on the social indicators stage? If you have that column, would you have to export it into your Excel and then look at all of them, or
to see the variance?
Well, if I wanted to say we have only so much money, we want to look at the places where we're most at variance with the country or the state as a whole.
Yeah. Yeah, and so like I said, my recommendation for that is really to look for some of those red dials. That's going to be your beginning list, and then from there, it's really important for you all to sort of use your local knowledge to determine what might be a priority, what might you have the funding to actually tackle, what there's passion around in your community. So I think that either using the dials as a guide point, or like you said, downloading the data to Excel and sort of doing a query that way. You could do either of those. Yes.
Thank you.
Yep. Great. Well, I'll go ahead and move into the map room, and we'll have time at the end for additional questions if there are. So that's really the reporting system. We do have a quick, just to show you, a data list. And so if you are wondering what all the data are that are available within that CHNA report that we've created, you can get a nice listing of this. And if you scroll all the way down to the bottom, you can get an export option. You can search for something if you're looking to see if something is available, that sort of thing. And then we also do have a what's new section. And so anytime we do a data update, we have an indicator correction, we'll post that here in this feed. And so you can see here that we are constantly making updates. That's one of the really exciting and we think valuable things about our reporting environment, is that you're able to know that if you come in on Monday and you make a report and we've updated some data on Wednesday, when you come back on Friday and you make that same report or you pull it up, you're going to have the most recent data available. We automatically update the data within our system, and so you don't have to do any work on your end to know that you have the most recent data available. So that's usually a pretty big plus for most folks, to know that they're always getting what we have that's most available.
Jamie, before you go to the maps, do you mind just clicking on the build a report at the top level link there?
Sure. Yeah.
I just wanted to mention that the selection of the indicators that we included on this reporting were built around categories for social determinants, and Tracy Flynn was involved in helping select those for this menu right now. Yeah, so it was kind of a collaborative voting effort where we all thought about what might be most useful.
This might just be my ignorance, having not been involved in this whole process, but I'm wondering, so the relationship then between the survey and the data that we're collecting locally and this publicly available data that's organized so beautifully, how do you see what's the interplay?
Well, the survey data, when Jamie demos the map, we can upload our own data into the mapping tool, which will be useful. And I'm looking at some other options on sharing out the survey data directly, but all of those that will, including like the highest variance indicators, will go into the final report. But I think to answer your question, Shirley, the survey results will be available in the mapping tool that she'll show next.
So if you remember, when we went at this, what we wanted to do is to provide a tool for the not-for-profits in the area who have to do community assessment reporting and go out and have all the reports developed. Well, here's a tool that they can shortcut and save some of their own staff time and maybe consulting time. Our survey tool will supplement that, but you're going to have to take that information and pull it together and analyze it. This is data, and it points to certain things. But if, for example, the perception is that we really have a problem with housing, but you know, if you look at the data and the number, I don't know, homeless. Couldn't read whether homeless was one of the data items, but poverty maybe, or you know, if there's a mismatch, you know, that dictates one type of approach. Whereas if you have you know, a huge variance on the data, and nobody's perceiving it as an issue. Why is that? I mean, that might be another approach. Maybe it's an awareness. So the whole idea was, for our needs, to have that information, what people care about, and what the actual data is. But the report was to mostly help everybody else in the not-for-profit world and healthcare to have some basis of information that they can use in their business.
And the other point, briefly, that community research page is intended to grow over time. So I'm working with Dr. John McCarthy at UW. Well, he's for the WAMI Medical School in this region, and he's going to have make this survey data available to medical students that are working on community health research. If they're able to do a short blog piece about what they found and use some of these tools, we can post it there. There's a housing assessment in Latah-Whitman County that I'm hoping we can include there. So as a forum for melding those two data sources together.
Well, and Dr. McCarthy will have access to the Institute for Health Metrics and Evaluation at the University of Washington as well, which has many other health data sets.
Yes, he mentioned that. That's a good point. They have some powerful data sets.
Yeah.
And the import that Jamie will show will demonstrate that. I've uploaded the Alice data for United Way in there as an example. We can grow that as well.
So I noticed that a lot of the data from this come from census sources, and I'm wondering, is there a mechanism built into this tool that would allow for automatic updates simply, or does one have to individually seek out each data point and input that individually, or is it linked somehow to the census reports?
Well, I'll answer that for Jamie real quick. And my understanding, correct me if I'm wrong, Jamie, they update it for all of those. We have to wait until they update the data. But they do it in a timely fashion since they work for all. You know, they push it out then to all of those networks that she described at the beginning.
So it's passive from our perspective, though,
yes.
And it'll show up if there's a big hole in.
Yes, exactly.
Okay.
Yeah.
And
so that those new sections would display what they do.
And Jane, you may address this, you plan to when you're doing the map room, but I'm wondering if we come across a big aberrancy in our local findings, if there's some big outlier and we just anecdotally or by some research find out what that is there a way to put an explanation into these things as well under that when you click on the little I button for more information?
Yeah, so just a couple of notes, I guess, based on the conversation that you guys were just having. We can absolutely add information to the report, the output of the report. So those STEM sentences that I showed, those are all customizable. And so what you see there right now are basically our, our, I don't want to call it generic language, but our best sort of language that we can use to sort of describe that indicator. But that is definitely customizable based on the area as well, or based on the information that you're collecting locally. And then also in terms of the ACS data, yes, and all of the data sets, we're constantly updating data. We have a team of people that's just what they do. The American Community Survey is the largest that we do each year, and so it does take us a couple of months to integrate all of that. But as I showed you in this What's New section, you'll see as those things start to get updated, and we'll post them one by one as they come through. So that's always a constant work that's being done here on our end. And then finally, we do have opportunities to build in what we consider local indicators. And so this report was really built around secondary indicators. But as you guys collect data and sort of grow your coalition or your strategies or how you're going to move forward, if you wanted to talk more about integrating some of those local indicators into our system, we can always talk about that. We have groups that do that, and we typically will do either like a biannual or an annual update on those, as long as it's something that doesn't get too out of date too quickly, like unemployment, right? But nonetheless, if you had a local or a state level data source that you wanted to pull information from, that is available as an additional service that we provide. So I'll move into the map room, and then if you guys have any questions, happy to circle back and answer some questions here at the end. So as I mentioned, and as you saw some of the smaller inset maps within the report, we do have a map room available within this hub as well. And so what you can see here is our search data window. So the first thing that you're going to do is you're going to find data one of three ways. The first one I'm going to show you here is to browse by topic. And so you can see that we have a taxonomy that we've built, a categorization again for all of the different data that we have available within our system. As you click through some of these carrots, you can see that the individual data layers themselves pop up, and you're able to click checkbox next to the indicator that you're interested in and add it to the map. Again, there's those nice little information buttons, so you know whether it's the right data layer that you're looking for, or maybe you're looking for different years. We do have multiple years for many of our indicators, especially from things like the American Community Survey and a lot of our environmental data. So anyway, I can add any of these, for example, to the map. So maybe murder isn't probably the most exciting one to add today. I can look for some economic data. So we have things around labor market, poverty, employment change, again, education. I would really encourage you guys to take some time looking through all of the data that are available, because as I mentioned, we do have 30,000 layers available. So there's a wide variety of information in here that's applicable across many different types of issue areas that you may be working on. So that's really the search by topic. You can also browse by sorts. And so if you are looking for a specific data layer from a specific source, you can see here we have currently about 235 different data sources that we pull from. So you can see some common ones like county health rankings, different sources from the EPA. There's those crime reports again, IRS organizations, national broadband maps. Those are new ones that we just added. And the list literally goes on and on. So that's also one way to search for something. finally, and probably the most easiest way, is just to enter a keyword. And so if you do, you're working on something related to housing, you can type in the word housing, and what you see here is we have about 685 different data layers that we've tagged related to housing. And so I can add things like public housing developments to this map if I were interested in doing that. We also have information related to things like mortgage lending, cost burden household, evictions, really a wide variety of information. So what you see here is I can also go back and I can change my search, so I can add something like poverty as well. And then I'm just going to go ahead and click add to map. So what you see here is that I've got 2 areas or 2 data layers that I've added to my map, and I'm automatically zoomed in to this area that you all serve, in and around this area that you all serve. And so what we're able to see here is that we're looking at, over here on the right-hand side is our legend, population below the poverty level, which is going to be 100% of poverty. And we're looking at it at a county level. And one of the most exciting or most useful, I think, parts of our map room is that we do have many of our data layers available at multiple geographies. And I point this out because so many groups that we work with, don't work just within counties, or don't find county level data as meaningful, right, as something like tract level. So instantly I can change that data geography from county to tract level. I could change it to school district if I'm looking at making a policy change within a school district possibly, or even a state senate district. I can't tell you how powerful it is to actually go to a state senator or a state representative and say, this is a map of your senate district, not a map of a county, not a map of the state, but this is what childhood poverty looks like in your district, right? Very powerful in terms of advocacy. We can also look at those in either percent or total. So here you can see this is going to be percent of the total population, or we can see those actual numbers here. I'm going to go back to tract here since that's one of our smaller geographies, and I can come into an area, right? And so what I'm looking at here, again, is census tract poverty levels, and I'm able to click the map and learn a little bit more, right? So I always encourage folks to click the map because as you can see over here on the right-hand side, this population below poverty goes up to what we say over 20%, right, in our scale. But the question really is how far over 20%, right? Or what is that actual number? And so this census tract I've clicked here is actually 27%, which is pretty significant when you're thinking about over 20% of the population living in poverty, right? And so it also gives you some additional important information, right? Like the margin of error, important for rural areas where you may have a very small county population or a very small tract population. So you're able to see that margin of error as well. So that's just a couple of notes then around sort of interacting with the map, right? I can use these plus or minus buttons here to zoom in or zoom out. I can also use this enter a location. So I think earlier you saw me type in, for example, the state of Idaho. I can also type in a county, so I'll use that one that I butchered earlier, and you can see that it zooms me in there. You can type in the name of a city or a zip code or an address, and it's going to zoom you into any of those locations. So at any point in time, you are also able to label those values on a map. This is very helpful if you were to add, for example, another polygon layer. So I can do something like uninsured, because I know that's a data layer that's a polygon layer. And I can add uninsured to the map here. And you're going to see that sometimes some data, they overlay well on top of each other and sometimes they don't. And so as I'm pulling up the uninsured population by tract here, you can see it's very helpful sometimes to, I think I have a delay from the Zoom meeting, to have those labels, right? So you can see both the variation in uninsured populations and you can see the variation in the population below poverty at the same time. Let me zoom over to an area that has some of those points on them. Did I lose some of those? Oh, there we go. Yeah. You can see here, I have also added public housing developments. And so there are some public housing developments in this area. Again, if I click the map, I'm able to see the property name, total units available, average monthly rent, those kinds of things, which can be helpful for doing on-the-ground work. At any time, I can also add reference maps. And so this is important, again, if you're thinking about taking these maps out into community and having conversations around some of these data layers. Oftentimes people need things like highways, right, to orient themselves. And so we do have just some really quick, accessible reference maps to be able to add. You know, people always know where they are sort of in relation, right, to the nearest highway. So you can always add those. You can add label counties, add county boundaries. And then we also have a satellite option. So if you are working in a more urban area, right, you can zoom in and you can start to see, oh, I know what part of the city we're in here. I can change the transparency on some of these layers to be able to say, okay, this is really the area that we're focusing on, or this is the area that we're in right now, those kinds of things. And so some of those reference maps can be really helpful in sort of helping orient folks and tell a story, right, about a specific area as well. And so at any time, oh, yep, go ahead.
Question. Is the best way to differentiate between close color, close hues to do the transparency adjustment, or can you add texture to any of those layers?
We internally, we can add texture to the layers, but we don't have that capability for like our front end users. So I would say, yeah, using the labels and the transparency is going to be most probably the easiest way for you all to do that.
Jamie, do you mind going to the starter maps and clicking on one of those just to show that it can be modified?
Yeah. So yeah, so if I go to click map my community, is there any, Mason, is there any one that you want in particular?
What about the medically underserved area? That has some
Sure. Yeah.
So that can be modified, I show.
Right, so this is a starter map that we made, and again, we can change locations at any time just by entering a new location. Again, we can add labels. Ooh, that gets pretty crazy if you add all those FQHC labels. Nonetheless, it's there, providers of service, those kinds of things. And we can click any of those, again, to get additional information as well.
Do you mind zooming into Lewiston? Did you hear that question, Jamie?
I did not, I'm sorry.
Do you have Indian Health Service and tribal data that can be accessed?
So we do have some very limited tribal data. That's something that just is not as publicly available. And so that could be a good opportunity for a data upload capability or something that we integrate on your behalf.
And we can add custom layers, right? I've looked at tribal boundaries. Some of that, but
yes,
we
yes.
can add custom layers.
Yes. And so, yeah.
I was hoping you might be able to go to the tools and like select those providers and then export it out.
Yeah. Let me add, so one that I know well, right, is this public housing development layer. And I just know the attributes well for this. So as I'd mentioned, there's several different attributes, for example, for each of the public housing developments. So we do have some additional tools. So we have a query data tool. So for example, I can select that public housing developments later. I can say I want to see all public housing developments in this area that have average monthly rent greater than $200, right? So that's my query. How many public housing developments in this area have average monthly rent greater than $200? Here we only have one public housing development, but nonetheless it becomes highlighted, right? It meets my query criteria, and I'm able to pull an attribute table for that. So you can see here that this meets the requirements. Its average monthly rent is greater than $200. I'm able to get all of that metadata and download that into an Excel file. We can also do that, for example, with some of the health centers that we see here, simply by doing a select data. So maybe we want to work in a very small geography or a specific geography, or want to learn about some health centers in a specific area. I can say I want to select by polygon, which would be sort of an unconventional geography, and I'm going to select all of those federally qualified health centers in that area. Again, there's only one in this area, but it looks like the Lewis and Clark Health Center, and it gives me the attributes, right, about that health center that's available. So those select and query data tools are available. We also have measurement tools. So this is helpful, for example, if you're looking to measure the distance between a public housing development and a farmer's market, for example. We have some mask tools, which are very nice for presentations. So for example, if I wanted to show some zip codes, just some very specific zip codes maybe that I'm working in, right? It's going to highlight those zip codes that I'm working in, and it's going to mask the area around it, right? And so I'm able to sort of say, oh, I kind of want to see a little bit of the area around it, or I don't want to see any of that area around it. So that makes for a very nice output when it comes to sharing and exporting if you are really centered or focused on a very specific area. We have a swipe layer. Let me go back here and turn my mask off so we can see the entire area that we're working with. We do have some swipe layers, so you're able to sort of see, this is good for 2 polygon layers where you're able to see multiple layers at one time. And then we do have some additional tools here around our vulnerable populations footprint and a location opportunity footprint tool. The VPF is a really powerful footprint tool because it looks at the intersection of education and poverty. So those folks who live below the poverty level and don't have low education. So that's just an additional tool that we provide and make available to all of our hub members here. At any time, if you mess up or you're like, I might have created a really busy map, you can clear the map and start from scratch, right? Or you can very easily go back to one of these starter maps and start all over and look at a completely different issue, right? So this one's more focused around food and food access, looking at major supermarkets, food desert census tracts, limited food access, those kinds of things. So again, as I mentioned,
Jamie, I think we're getting short on time, but briefly you can share these, right, in both the static and then the dynamic maps
yep.
as well.
So you can share them very easily via social media, email, send someone a map link, or you can export it. So one of the things just to mention is that when you share a map, the person that you share it with, they can move around, they can add data, delete things. It's not going to mess up the map that you've created. And so I'm not logged in here, but one of the things that we do have available when you're logged in is the data upload function. And so that's what Mason was talking about a little bit in terms of being able to actually collect community level data and upload it into the system, overlay it on top of the already existing secondary data that we have within our system, and start to make some of those correlations or do some light analysis that way. So I'm happy to log in, Mason, if we have time, but otherwise I'll heed your time warning here.
I think that can be the teaser for next time. But should we ask if there's any final questions, Dr. Richard?
Probably did enough.
Great. Well, thank you. This was very helpful. I think you covered, a lot of the features and functionality, and we'll look forward to sharing, ideas to help this grow and, get more use from the community.
Great. Yeah. And if you guys have any questions, any follow-up questions, I'm always happy to answer your questions by email or do a screen share like this and walk you through either the mapping or the reporting environment and answer any questions you might have about it.
Thank you. Thank you, Jamie.
Thank you.
Yeah.
Oh. I'm sorry.